Today I'm talking to Deborah Bailey, who's a chartered physiotherapist at the Warr Clinic, about tennis elbow. So tell me, what is tennis elbow, Deborah?
Okay, firstly, you don't need to play tennis to actually get tennis elbow. Commonly, any pain on the outside of the elbow is actually referred to as tennis elbow, but specifically, true tennis elbow is actually an overuse condition of the extensor tendons, where near the lateral epicondyle, which is actually on the side here. So it's often called lateral epicondylitis as well.
And what's the symptoms of it?
The symptoms can be quite mild, or they can be really, really severe. The mildest form, you'll often just have a little bit of an ache coming on the outside of the arm, and that can get progressively worse with activity on gripping, rotation, or extending the wrist. It can actually be really, really painful, so it could actually wake you up at night and everything as well.
And what causes it?
What causes it? It's usually repetitive movements, like an overuse, so anything which involves a lot of gripping, a lot of, if you like, tension in the forearm, so hitting balls on the tennis court if it's amongst tennis players, screw driving, any of the video games where it's repetitive. And it's anything really where you're doing it continually. So waitresses get it, carpenters, all sorts of professions can actually cause, have these problems with tennis elbow.
And how would you treat that as a physiotherapist?
First of all, you've got pain. Often there's swelling there, and tenderness and muscle weakness. So what we do is we aim to get rid of the pain first of all, encourage the patient to actually use ice regularly to actually reduce the inflammation. We can use modalities such as ultrasound, laser and acupuncture, as well as deep frictions into the tendon itself. Things like tennis elbow support will actually really help protect the tendon and take away the pain because it alters the angle of pull. Sometimes people will have non-steroidal anti-inflammatories or painkillers as well. So the most important thing actually is to get the forearm muscles strengthened and stretched. So we'll give specific exercises to actually load the tendon, and that actually should be the biggest treatment of all, really.
And if you are a person who has to do something repetitively, would you be able to? How would I be able to prevent it? Would that be knowing what sort of proper exercises?
I mean, sometimes it's impossible to actually prevent tennis elbow occurring all the time, just because it's almost hit you before you realise, and you've just done a little bit too much, and you just, it's the straw that breaks the camel's back. If you know that you are prone to tennis elbow, wearing a tennis elbow support when you're actually going to have to do an awful lot of work with your hands or lifting or carrying is quite a useful thing, and also strengthening your muscles and stretching all your joints out as well, so the tendons and everything out as well.
Yeah. And what if I go about preventing it, but unluckily I do get it, how long does it take to get better? Is it one of those things you can be prone to?
It depends how severe it is. It can take anything generally between 2 and 6 weeks, although more chronic cases can actually take a little bit longer. Yeah. And then it might be further treatment is, from the GP, or surgical intervention might be required as well.
Oh, lovely. Thank you very much.
Pleasure.
And as always, if you want to make an appointment, the number will follow. If you want some more information, there's some more information on the website.